Hi guys, today we have a very exciting guest. Her name's Nicole Finn. Many of you guys have probably seen her from TikTok. Um, you can follow her. I'll put her IG. It's right here, Nicole Finderm. It's on a question chat. Um, I have a little bit of announcements I want to get through before we get started. We just created a new program. It's called My Med Atlas. I just want to go over with you guys real quick. I think it's really important for those who are looking for information about direct med. We're going to be hosting sessions. It's going to be smaller sessions, it's about 50 people that we're going to host in sessions. It is a paid session. So, but all the information about that is posted in the link of our bio, My Med Atlas. You can go and there's information about program, what the fee is, what's all about, how to sign up. So be sure to check that out if that's something that interests you. And it is open for high school students up until high school, all students from high school up until freshman year of college. We're taking admissions after freshman year of college. Probably not, because it's just very small percentage of programs that are open. So we're just opening it up until freshman year of college. And if you're looking for verification of hours or credit, you can write us a summary. And for the summary, it's nothing too big, just 3 to 5 sentences. You can email us that to clubmedshoe@gmail.com, and information about that too is posted in our Insta bio. So I'm just going to do this real quick because I know some of you guys are here for the first time. So just go in Instagram, click on the link tree, scroll down, guidelines to putting sessions on the application and resumes. Right here. It also shows you like how you can write this if on your resume, and information about where to send the summary, just 3 to 4 sentences. Like I said, clubmedshoe@gmail.com. Let's go back in the bio. Also, you can also sign up for our weekly reminders. Register for virtual shadowing call reminders. This is not registering for the program. All you got to do is show up. That's all the sign up that you got to do. But if you are looking for like weekly reminders, you can sign up for that. I know this week's email did not get sent because there was a error. There was a error with our server and something going on, and we were not able to get that sent out. So we're sorry if you didn't get that email, but I am getting in touch with that company because it's the second time it's happened, and we do pay for that. So, and this is unacceptable. It's the second time it's happened. So I'm meeting with them to make sure that never happens again. But we sent those out every week ahead of time. But if you do not, just go into our Instagram bio. We post information about what the future session is going to be a couple days in, not a couple days, I should say 3 to 4 days in advance. So you know like what time it is, when it is, and who it is. Great. Go back. You can also register to volunteer with us, and we have a separate Instagram for that. It's called @officialclubmed.volunteering, and all information about how to sign up, what we offer, is posted in the link tree in the bio. And other than that, if you have any other questions, just DM us on Instagram and we'll get back to you. One quick note before I move on: for the verification for the hours, that is only for 2021 sessions. And I think this is our third one. So just that, and in terms of when they're going to be due, probably in mid-May, but we will post exact date when we get close to that. We'll give you guys plenty of time in advance, and we do ask that you hold on to your summaries until the end, because it is just quicker for us to just process them all together in one email. But with that being said, you can also send them as you go. Like, we understand sometimes it's urgent or you just want them as you go. That's fine too. Just send them weekly if you'd like. But that's it for announcements. Let's get to the presentation. Let's get to the call with Nicole Finn. Like I said, she's a famous TikToker. She's a certified dermatologist, physician assistant. So if you're interested in dermatology or skin, this is the call for you. She has a master's in physician assistant studies, and I will let Nicole get started.
Okay. Well, thank you for saying I'm famous. I like that. All right, I'm gonna share my screen. Okay.
Oh, one more thing. Nicole will go talk about it, actually. Yeah.
Oh, okay.
Yeah, Nicole's going to talk about it.
All right. So hi, I'm Nicole Finn. I'm a PA, a physician assistant, And yeah, so we're gonna be doing a little virtual shadowing today. And I'm gonna go through you guys a little bit about what a PA does and everything. And then we'll kind of go through what my day-to-day life as a PA is so that I can kind of feel like you guys are actually there physically shadowing me. So, a little bit about me. So, I'm a physician assistant, and I've been a physician assistant for 2.5 years now. I graduated King's College, which is in Wilkes-Barre, Pennsylvania, in 2018, August 2018. And a week after that, I took my PANCE exam, which is the certifying exam for PAs. And then a couple weeks after that, I started my first job. So a lot of people will take a little break in between graduating PA school and taking their PANCE exam because they want to study for it. I started studying for it probably a good 5 to 6 months in advance. And I would study a little bit every day, like an hour every day. That just kind of works better for me than trying to cram everything all together. And I'm the type of person where I want to graduate PA school and take the PANCE exam right away. I didn't want to wait, but that's just me. You don't have to do that, obviously. But I took the PANCE exam 1 week after. And then a lot of times people will take the PANCE exam and then they'll kind of, then they'll start applying for jobs. That's not me. I wanted my job right away and I wanted to start right away. So I started applying for jobs again, a good 5 to 6 months in advance before graduating. And then I signed my contract with my job about 3 to 4 months before starting. And the job I started in is the same job I'm in now. So I've been working there for 2.5 years. And it's called Schweiger Dermatology Group. They're located, well, I work in New York City, but we actually have 65 offices. So it is outpatient private practice dermatology, but we're a pretty large company. We have offices in New York, New Jersey, Pennsylvania. If anyone on this right now has ever been to one of our offices, put it in the chat. That'd be super cool. Or if anyone's in the area, definitely come visit one of our offices. If we take your insurance, which we take most insurances, then you can come in as a patient. So yeah, so I've been working there for 2.5 years. And I did a fellowship, which a lot of people always ask me about this because PAs, we are not required to do any fellowships or residencies. But there is some places that offer as an option, but by no means do you have to do it. It's not going to make you, better than any other PAs. It's kind of just optional. And my company that I work at, Schweiger Dermatology Group, they did offer a fellowship program. So that's why I did it. And also another really popular question is people always wonder about getting into dermatology because if anyone knows about applying for dermatology, it's pretty difficult and competitive. And the reason for that, a lot of dermatology places want you to have around 3 years experience before they hire you. But how are you supposed to have experience if no one will hire you as a new grad? So I applied to many, many dermatology jobs. I can't even tell you how many, but I applied to a lot. So my best advice is honestly just keep applying and try to network and meet people that work in dermatology. I actually met someone who worked at my company, the company that I work at now, and I messaged her on Instagram asking if I could come shadow her for the day. She said yes. I came and shadowed. She put in a good word for me. And yeah, the rest is history. So those are just some tips if you're looking to get into dermatology. Right now, I'm getting my doctorate, and that's another pretty popular question that I get a lot is about my doctorate. And so I started that last week, and it's going to take me about 1.5 years to complete. I'm doing it at MCPHS, Massachusetts College of Pharmacy and Health Sciences. That's such a mouthful, but if anyone goes to that school or is planning on applying to that school, it's in Massachusetts, obviously, but I think it's in Boston. You can write that in the chat below. Oh, also, if anyone goes to King's College in Wilkes-Barre, Pennsylvania, definitely say hi in the chat because it's a very small school, but I get a lot of people that message me on Instagram saying that they go to King's College, and that's so cool because it's a pretty small school. So for my doctorate, so a lot of people confuse it. I'm not going to medical school at the end of my doctorate, I'm not going to be an MD. So yes, technically you can be called doctor, like I can be called Dr. Nicole Finn, but I would never introduce myself to my patients as that because that's pretty confusing. And I don't want them to think I'm an MD. So I would still introduce myself as Nicole, the PA. But I'm doing it not really for patient reasons, more for personal reasons. And just to get into it briefly, a lot of nurse practitioners are getting their doctorate nowadays. So, not that I'm really competing against nurse practitioners because I love nurse practitioners, but kind of in a way, I want to be competitive when, I'm applying, if I ever, apply for any other jobs, and I want to have my doctorate too. Also, I'm specializing or focusing more on health administration so I can eventually, kind of go into more an administrative role. I'm just the type of person that I'm always just kind of looking for more, and I always want to do more and just push myself to my full potential. So that's why I did that, but by no means do you have to do that as a PA. Another thing is I recently have become a USERN speaker. So what this means is that I'm going to be an official speaker for USERN at USERN events. They're not open to the public. They're pretty small events that are only for providers that work in dermatology in New York City or in the New York area. So this is actually a big deal for PAs, and a lot of people don't really understand what exactly that means. So up until recently, a lot of these speaker events or these special events, especially in dermatology, it's always an MD that speaks at them, as they should. But so this is a big deal because not really PAs do this. And so, a big goal of mine is just to be a huge advocate for PAs and again, just try to have the PA profession just, reach its full potential. So it's a huge deal that a PA, and there's other PAs and nurse practitioners as well that are going to be speaking at these professional USERN / other brands, not just USERN speaker events. And now just a little bit about hobbies. So what am I doing? What is Nicole Finn Derm doing when she's not working? So obviously I'm very active on social media. I started becoming pretty active in around May or April of 2020 because honestly I was bored. I was really bored in the pandemic. So yeah, I just started making some videos on TikTok and people became interested in them. And then it just grew from there. And now it's like a huge passion of mine. If anyone follows me on Instagram or TikTok, I'm constantly posting. And on YouTube, not as much. I would like to post more on YouTube, but I just, to be honest, don't really have the time to do that. So yeah, so I do a lot on social media. And then also, some other things that I like to do. I do like to go to the gym and work out. And, as most people living in New York City, we're pretty social and we like to hang out with friends a lot and go out and do things. Obviously, not so much right now because of the pandemic and everything going on. It's not really much to do. Well, there's still a lot to do in New York City, but not as much as usual. So yeah, typically I would go to restaurants and bars and just have fun with my friends. Kind of work hard, play hard kind of thing. So that's a little bit about me. All right. So now that you heard a little bit about me, what else am I going to be talking about? So you're going to learn a little bit about what a PA is, what they do, a little bit about how to become one, although that's a huge another topic. And then again, I'm going to do the day in the life of dermatology PA so that it kind of hopefully can feel like you're shadowing me in real life, even though it's going to be through the computer, and go over a couple of case studies and then a quiz. So there's going to be a quiz at the end. I'm going to ask a few questions. So everyone better be paying attention because you better get these questions right because one person is going to be picked who answers a question right and they will win something. So they'll win a little prize. So at the end, we'll pick someone and then that person, we will ask for your Instagram name or just some way that we can get in contact with you. And then of course, if you guys have questions, put them, in the chat and we'll try to answer them.
Sounds good to me too.
All right, great. So what is a PA? And a lot of people on here probably are like, I already know, but there's also a lot of people on here who might not know. And there was a period of time in my life when I was younger that I had no idea what a PA was. What does that mean? So a physician assistant, so we are mid-level providers and we are practitioners. And what do? So we see patients, we evaluate them, we diagnose them, we treat them, and we can prescribe medicines and do minor procedures. So I think a lot of times people think that we are, assistants. Like we're always assisting someone, which is not the case. We're not going to be performing surgeries. Like we're not going to be performing orthopedic surgery and stuff like that. That's not what we're going to do, but we could assist in those surgeries, and then also, in private practices, like for instance, dermatology, now patient care, we can do minor procedures on our own. So I think a lot of times people think that we're not independent, and our name kind of gives us this whole vibe that we're just assistants, but we're very, very independent. And it's going to depend, the range of our how independent we are is going to depend on the job. But majority of jobs out there, we're doing everything. We're going to have a supervising physician. There is going to be an MD. And like I said, every job's gonna be a little bit different. I remember I applied to a dermatology job where they told me that I was gonna be seeing my own patients. I was gonna be on my own about half the week, and then the other half of the week working with the MD. For me, that just wasn't really what I wanted. I wanted to be completely independent. And that's why I love my company so much, because PAs and nurse practitioners, we're completely independent. We have our own patients and we care for them on our own. And my supervising MD, supervising physician, I have a great relationship with him. We get along super well. And for the first 6 months that I started working the company, I shadowed him. And, he taught me so much, and I'm so thankful for that. And then after 6 months, I started on my own, and I was seeing patients on my own. And so now he's there for me, though, if I, need a little bit of help. I will text him or call him if I have a question about something. And then sometimes I'll send him some cases on some patients that I just want to make sure that my treatment plan is the best treatment plan for this patient. So maybe I'll send him an email with the case number, and then he'll take a look, and then, we'll kind of talk about it a little bit. So he's always there for me if I have, a question about something, but otherwise, I'm pretty on my own, which is pretty cool. So now we'll get into a little bit about how to become a PA. So everyone out there, write in the chat, where are you guys in, applying to be a PA? Are you not even sure about if you want to be a PA? Are you currently in undergrad? Are you currently taking a gap year? What are you doing? Let us know. So how to become a PA. This is going to be a pretty, more condensed version. Like I said, this you could talk about forever.
Yeah.
But yeah, it's just we don't have the time for that. But I do try to, touch on a lot of these topics on my social media. So, give me a follow, because I do try to talk about these things a lot. So you're going to go to get your undergrad and your bachelor's. And a lot of people ask, what is the best major? Actually, that's a really popular question that I get. And you can do any major you want technically, because you just can, as long as you get the prereq classes you need for PA school. But I will say, doing a major that's more like a health science type major, it's just gonna be easier to get the prereq classes that way, but you don't have to. So what are the prereq classes? So these are gonna be the classes that PA schools require you to have to get into PA school. So these are going to be your bios, your gen chems, orgochem, usually just orgochem 1. I don't think really 2. A&P, microbiology. So these are the classes you need to get. That's why it's going to be easier to get these if you are some sort of health science major, but bio, neuro, psych, anything like that. But like I said, you don't have to.
And and like prereq classes in terms, just something I want to add to, like every school has their own requirements in addition to that too. So like if you're looking for like programs near your state, be sure to like look at what specifically they want to. But over encompassingly, like Nicole like said, those classes are going to be required for the most part in any PA program, but there's going to be more specific requirements that you're going to have to meet. So check out those depending on whichever program you apply to.
Yeah, definitely. And, you know, when you're looking at programs, you know, write down all the classes that the program's going to need. And, you know, obviously take the classes that the program that you see across the board that the programs, you know, are definitely all needing. And then for grade wise, I'm pretty sure you have to have a cert. I think majority of schools, I think you can't get below a C, I believe, in prereq classes. If anyone knows differently, you could say it in the chat, but I'm pretty sure that's what it is.
What would you say is like a competitive, or I should say competitive or an average GPA for that someone who's accepted into these programs?
Yeah, I would say around like a 3.6, 3.7.
3.6 or above.
Yeah, I would try to shoot for that. You know, I was going to talk about this a little bit, but PA school is getting more and more competitive, unfortunately. A lot of people are applying to PA schools, and a lot of people that are applying to PA schools are having, you know, really high GPAs. They're having incredible amount of patient care hours. So the best you can be, obviously your best chances of getting in. But yeah, I would definitely shoot for around 3.6, 3.7. And then for patient care hours, I would shoot for around 2,000 hours. So you're gonna need to get shadowing hours as well as patient care hours. So like I said, I would shoot for around 2,000 hours. And I got that number. I actually did some research months ago to look at averages of patient care hours. And not so much the schools, how much they were requiring you to have, but how much the students that were getting accepted into PA schools, how much they had. And there were students with 3,000, 4,000 hours. So yeah, I would shoot for 2,000.
And Nicole, there was a question about in the chat too earlier. In terms of patient care hours, what are some good ways somebody can? I know CNA is one of them. What are some other ways? Could it be a volunteer too, or?
Yeah, no, there are some things you could volunteer. It has to be direct patient care hours. So a lot of places where you volunteer at like hospitals and stuff, there are some things where you could be directly with the patient, but a lot of times things like that, you're more you might be more like doing like stock inventory or being a greeter, stuff like that. So volunteer, yes, but you just have to make sure to direct patient care hours. But CNE or CNA, what am I talking about? CNA, EMT, medical assistant, you know, there's so many medical assistants I know right now that are, you know, getting a lot of hours and they're gonna apply to PA school. And, you know, people in the chat, if you wanna, anyone who's getting patient care hours right now, if you wanna put in the chat what you're doing, and then that can give everyone else some ideas.
Yeah. And for in terms of like how to become a CNA, I know that right because of COVID right now, I think that might be one of the easiest way to get hours because usually there's certification that you have to do CNA, but most states, not all, most states are waiving that testing. So all you got to do is just find a place that's near your home and call and see what they can do for you. And most companies will hire you on the spot because like they need it. They need the people. So I think that's one way you could get. And CNA hours, you can. I mean, if it's 2,000 hours, you got to plan ahead of time. Like it's not something you get done in a month. Yeah.
Yeah, definitely. Yeah, if you can get a CNA, you know, if you don't need if places are, you know, waiving, yeah, I mean that'd be a great option. So so you're gonna get all these things, and then on top of it, there might be some exams you're gonna have to take to get into PA school. Not all PA schools, but there is a, you know, a good amount of PA schools that are gonna require the GRE. And so that's a whole other thing. You're gonna have to study for the GRE now. You're gonna have to get some test prep books and start studying for the GRE. But like I said, not all PA schools are requiring it, but there is a good portion of them. So just be aware of that. And then there's also going to be PA school interviews. And that's a whole nother topic that you can talk about for a very long time about how to prepare for PA school interviews. So you're going to do all of this, which seems like a lot, and then you're going to apply for PA school. And, you know, like I said, PA school is getting more and more competitive. So a lot of times people have to take gap years. So after they graduate, before applying to PA school, their intake takes a gap year or gap years to get all of these things I just mentioned to apply for PA school. But you know, if you know that PA is what you want to do and you start right away in undergrad, you can definitely get all these things done, and then you don't have to take a gap year. But it's just a lot of people don't know, which is completely normal. There were plenty of times in undergrad where I thought I was going to change my major and yeah, maybe not be a PA anymore. So it's completely normal to not know. So once you apply for PA school and you get in, then they're going to be split into didactics and clinicals. So PA school is going to be around 2 years, but some of them might be a little bit more, like could range from like 24 months to 36 months, but that's kind of an average. So usually it's around didactic year, it's around a year, and then clinicals is around a year. So didactics is going to be your classroom. That's going to be where you're taking all your classes. And yes, it's pretty difficult. And what makes it difficult is because it's very condensed. So you're taking all these classes, you're learning so much medicine in a year. So that's what makes it difficult. But you're going to be taking pediatrics, GI, dermatology, infectious disease, surgery, emergency medicine. I mean, you're going to be taking it all. And then in clinicals, that's going to be when you're going to be doing your rotation. So you're going to be going to hospitals or outpatient offices. Usually they're anywhere between 4 and 6 weeks as an average of how long each one is. And you're going to do it in different areas of medicine. So you might do one pediatrics, family medicine, internal medicine, psych, and sometimes you can pick a specialty. So obviously I picked dermatology, but some schools don't let you. But yeah, so you're going to be doing your clinicals. So that's really where you're going to be learning a lot of hands-on. And, you know, they'll let you do practice, you know, procedures and taking blood pressures and everything like that. And once you complete all of that, then is the PANCE exam. Like I talked about, it's the certifying exam. And like I said, I studied for it starting 5-6 months before, but sometimes people just wait till after they graduate to start studying for it. And that's fine too, whatever works for you. A big thing people are always very stressed about is paying for school. How are you going to pay for PA school? So PA school average, I would say, is around maybe 60 to 80 or 100,000. That's kind of like the range. It obviously could be a little bit more, a little bit less. My PA school was around like 84,000, 85,000. So obviously I took out loans, as most people do. And I think, you know, it's not really something to stress about. Just know you're probably gonna have to take out loans. But, you know, with a PA salary, you should be able to pay the loans back. It shouldn't be an issue, although everyone's situation is different. Some people have more financial responsibilities if they have a family and kids, but usually that should still be okay. Just want to briefly touch on accelerated PA programs because that's what I did. So some people know this, some people don't, but I went to King's College and I went there for undergrad as well as PA school. So I did undergrad in 3 years and then went right into PA school. I don't even think I had a break at all. I think it was like I finished my 3rd year. Yeah, I finished undergrad and I think a week later I was starting PA school or like an online class for PA school. So this means that I applied for all of this when I was in high school. So when I was a senior in high school, I applied to accelerate PA programs, meaning if I got in, I would be pretty much guaranteed a seat in their PA program as long as I met all the requirements. That being said, there are some PA programs that still, even if you meet all the requirements, you might not be guaranteed a seat if there's too many students and they don't have enough seats. So that's something to look at for accelerated programs. You want to make sure you're definitely going to be guaranteed a seat as long as you meet all the requirements. So that's what I did. And That is definitely the most easiest, less stress way of going to PA school is if you know when you're in high school that that is what you want to do, which like I said, a lot of people don't know, and that is completely okay. But if that's something you know you want to do, then I would definitely look into programs like that. So that way you can apply in high school and you'll be all set. Obviously, you're still going to be doing all the, pre-req classes, patient care hours, everything like that, but it's not going to be as competitive as if you had to apply after undergrad. All right, so now let's get into day in the life and let's get into you guys actually, feeling like you're with me and shadowing. So I work Monday through Friday. I work 38 hours and my hours every day are different, but they're the same every week. So every Monday I work 8 to 6. Tuesday I work 7 to 1. Wednesday 1:30 to 7:30. Thursday 9 to 7. And Friday 7 to 1. So I go into work and, get set up, put my things down, and then it's time to see patients. And the amount of patients I could see, it varies. I think the most I've ever seen in a 10-hour time frame was maybe like 50 something. Usually patients have a 10-minute appointment. There are instances where obviously their appointment's longer, but usually most patients it's a 10-minute appointment. So I'll see patients and obviously, evaluate them, diagnose them, treat them, prescribe medicines. And then when I step out of the room, I will do my notes. So every patient you have to write a note for. So I'm going to do my notes, go over any labs, if any labs came in for patients, like biopsies or lab work, answer any patient messages because patients do call because they have a question about something or their prescription wasn't covered by insurance, stuff like that. But pretty much my day is, I don't really have that much free time. I mean, pretty much I'm busy all day. If it's a light day or for some reason there's not as many patients, maybe I'll have a little bit of downtime. But majority of the time, I'm so busy just doing all these things. And then we're going to go into some procedures. So, besides, seeing patients, I'm doing procedures on them. So I might be seeing, it could range. Every day is different, acne, rosacea, hair loss, nail issues, full skin exams, skin cancers, rashes, which I mean, rashes is huge. There's so many different types of rashes. And so there's going to be different instances where I'm going to be doing procedures on patients. Biopsies. So there's a shave and a punch biopsy, which I'll go into a little bit later. So I have some videos. But that's where we take pieces of skin and send it to the lab for testing. And then the pathologist will look at the pieces of the skin under a microscope and we'll do some testing. And that's where they can determine any skin cancers or what's going on with the skin. Cryotherapy, which is, I refer to it as like a freeze spray. That's how I tell patients. It's liquid nitrogen. If anyone's had this done, comment in the chat because it's a very common procedure. We do it a lot for warts. So a lot of people come in for warts. So we do this. Precancerous lesions. So we can treat precancerous lesions as well as some cancerous lesions. We can treat with this liquid nitrogen. As well as benign lesions. So lesions that are medically fine. They're not harmful, but sometimes patients want to treat them cosmetically. And then injections. There's so many different things that we inject for. I feel like I've become pretty skilled with syringes and needles, but cysts, we inject cysts that could range anywhere between a small acne cyst to a huge cyst and abscess. Alopecia, which is hair loss. So we'll inject some forms of hair loss. Keloids, which are scars. So we'll inject all of these things with steroid. So it's called Kenalog. And then INDs, which is incision and drainage, which we do for big abscesses. We have to drain pus. Botox for hyperhidrosis. So this is Botox that is medical, so it's not cosmetic Botox, and it's for excessive sweating. And then also cosmetic. So these are just the most common procedures. There's obviously so many more that we do, but these are the most common that we see on a day-to-day basis. So now I'm going to go into a couple of case studies so that it can kind of feel like maybe you guys are seeing a patient with me. So this is a 30-year-old female, and she's coming in for a chief complaint of changing moles. She says that the moles seem to be growing in size. They have been there for 5 to 10 years. They aren't causing any pain, itching, or discomfort. She has a family history of melanoma. Her mother, she denies any previous skin cancers or biopsies, and her last full skin exam was 1 year ago. So I'm going to show you guys what a full skin exam is. So if you guys were actually shadowing me in person, you would definitely see a few patients throughout the day coming in for this, and you would see me doing this. So I'm going to play this video. So I'm going to talk over the video because I feel like it's better if I explain it than having the person in this video explain it. But patients come in for full skin exams, and we're going to look at their moles from head to toe. So it's a full body skin exam, and we're looking for any moles that are suspicious of cancer or precancerous. So a patient's going to come in, and usually we'll do a little history. So like a medical assistant might take a little history down, ask them when their last full skin exam was, did they ever have any cancers, skin cancers, precancerous lesions, or anything suspicious, ever had any biopsies, family history of skin cancers. So we'll get all of that info down because that's super important when we're screening the patient for skin cancers. And then we'll give them a gown, and they're going to change into the gown. Everything's going to come off. I let patients keep on their underwear though. And then, you know, I just let them know if they have any moles in the groin region to let me look. A lot of patients, female patients, they will see their GYN once a year, and the GYN always looks to make sure there's no moles in that region, and if they are, they'll always refer them to us to take another look at. So everyone does a full skin exam a little bit differently, but for the most part, it's similar, if that makes sense. So this patient's laying down. I prefer my patient to be sitting up, and then I also will have them stand up, but it doesn't matter. And we start head to toe. That's just the best way to do it, so you make sure you're not forgetting anything. So she's starting out by looking in the scalp a little bit. It can be sometimes a little bit hard if people have really thick hair. So I always ask them if they have any moles in the scalp that they know of. So that way I'll make sure that I definitely see that one. And then you're going to look at the face, the ears, neck, the arm, the fingers, hands, even the fingernails and the toenails. Because yes, you can get skin cancers in your nails. So if you're ever going for a full skin exam, make sure you're not going with any nail polish or anything like that on, because we want to see your nails as well. So when we go around, we're going to be using something called a dermatoscope. So you'll see what she's holding right there. Hers is pretty big. Mine is not that big at all. But basically it has a light on it so you can see better. And then it also magnifies so we can see patterns in the mole. So dermoscopy is what it's called when you use this dermatoscope and look at patterns in the moles. And this allows us to detect more skin cancers or precancerous lesions than just looking with, you know, our regular eye. So we're going to go around with that, looking at moles. And any moles that are suspicious, then we'll mark, usually with like a little pen or marker, take a picture of it. Sometimes we'll measure it too. And any moles that are suspicious of skin cancer, obviously we're biopsying them and they're going to the lab. If there's a mole that's just kind of, but we don't think it's skin cancer, you know, we'll just mark it, and we'll take pictures of it, and then I'll have a patient come back in a few months, and we'll just see if there's any changes to the mole. If the mole changed at all, then we'll biopsy it. So this patient, there was something they marked, and so they're going to biopsy it. So she's signing a consent right now. And once we do the biopsy, obviously we put it in a biopsy bottle and it gets sent to the lab for testing. Afterwards, the skin's going to heal up like you got a little scrape on the skin. So usually we just tell patients to put Vaseline or Aquaphor in a bandage, and that's pretty much it. As long as you're taking good care of the wound, it doesn't usually become infected, so you don't need any antibiotics or anything. So she's going to do a biopsy on this patient. I'm not going to really show you too much of a biopsy because I'm going to show you guys some other videos in a little bit where they kind of do more close-ups of the biopsies. So I think we'll just stop the video there. But basically, so she did the full skin exam, found a mole that she thought was suspicious, and then she's gonna do a biopsy and send it to the lab. So this is something very common that I do every day. So another thing is, like I was talking about, injections. So this is injecting keloid scars. So we're injecting it with Kenalog, which is steroid. Anyone, have you ever had any keloid scars injected? Comment in the chat, or anyone ever have any full skin exams, any biopsies? You know, what was your experience too? You can let us know in the chat. So keloid scars, so they're raised scars, and some people are more prone to getting these scars than others. They can happen after surgeries. They can happen after a pimple, a bug bite. I mean, any trauma to the skin. And we're injecting steroid into the scar to try to flatten it. It's not going to make the scar just disappear, but it will make the scar flat so that it's not raised anymore. And by making it not raised anymore, the patient feels better cosmetically, and then it also feels better because a lot of these raised scars get itchy and uncomfortable. So I'll show you guys this video. So there's different ranges of Kenalog, or different strengths of Kenalog, I should say. So kind of just depends on what the scar looks like and how raised it is. Depends on what strength of Kenalog I'm going to inject. So this person obviously had surgery. It looks like they maybe had a breast lift or maybe breast augmentation. So they have some surgical scars left behind. So going in and, like I said, injecting the Kenalog into the scars. And it's not just one treatment. Usually one treatment doesn't do the trick. It's usually we do a series of treatments. So usually patient will come back every 3 weeks, and we'll continue to inject until, you know, they're flat. It could take a couple of treatments, or, you know, it could take many treatments depending on how thick and big the keloid scar is. So if anyone's ever had this before, you know, like I said, let us know, and let us know if it hurt or not, because I know it definitely does hurt because there's scar tissue. So it definitely hurts more than if you just injected skin that didn't have any scar tissue. So yeah, so just injecting all the keloids. So we're not gonna watch this whole video, but that's injecting keloids. So this patient that came in, like I said, they had a mole, it looked suspicious. So we did a shave biopsy, which again, I'll show you that in a little bit. The biopsy specimen was sent to the pathology lab for testing. Also, upon examination, one wart was found, and it was treated with cryotherapy, which is that freeze spray I talked about. And then she also had a keloid scar from her previous surgery, so we injected it with ILK, which is that Kenalog injection that I just showed in the video. So now I'll get into the second case study. So this is a 29-year-old male, and he presents to the office with a large bump on the back. It began 1 week ago. He complains of pain, and it's getting worse. And he's also complaining of a mole on the leg that is changing colors. It has been present for 1 year. He denies any previous skin cancer. If anyone knows what this picture is of, the one, not the mole, the one on top of it, let me know in the chat, because we're gonna watch a video, and yeah, you guys will see. But if anyone knows what this is, let me know. So we're gonna watch this video, and I'm just warning you, if you get really grossed out by pus and blood, maybe just turn away for a little bit and don't watch the video. Also, if you haven't eaten dinner, yeah, maybe, I don't know, maybe just close your eyes for a couple of minutes. This might make you lose your appetite. So I'm sorry. For me, I think it's cool. I could drain abscesses and then go eat lunch 5 seconds later. Doesn't bother me. But for some of you, it might. So
you're saying cyst, like hundreds.
yeah.
There we go.
All right. So for those that want to watch this, it's not gonna be that bad. I'm just like hyping it up. But so a patient's gonna come in with this abscess, and it's gonna be filled with pus, and patients are in pain. You know, it's very swollen, it's very painful, and they need to have this drained. We need to get all the pus out, and usually I'll put them on, actually always put them on antibiotics. usually oral antibiotics, sometimes topical antibiotics, and then they'll usually be on oral antibiotics for a week, and then I'll have them come back in a week, and we'll see how it went. Hopefully, it should be getting a lot better in a week. I've never, knock on wood, had to drain it twice. So this patient has an abscess. It's on the lower back. So they just cleaned the area. It looks like they use Hibiclens, but in my office, we'll just use alcohol pads. We'll clean the area. And then we have to numb the area really well. So you're going to see him injecting numbing medicine, which is lidocaine, and there's probably epinephrine in it as well, because we're going to take a blade and actually open up the skin. So patients are already coming in pain. So obviously we want to try to make this procedure more comfortable and have them not in as much pain. So we're going to inject this area as much as possible with numbing. So that way they're not going to feel the blade going into the skin, because we're going to open the skin up, decent amount. So here you see him injecting the numbing medicine. So, I mean, this part is going to hurt a little bit. It is a needle going into the skin, and numbing medicine tends to burn. It feels like it's burning a little bit. And so it works right away. So right away, the area is nice and numb. And then we can go in with a blade tool and open up the skin. And after the fact, we don't put any stitches or anything. The skin's going to be open and heal on its own. And we don't put stitches in because we want, this abscess is going to continue to drain pus on its own, so we want it to continue to drain. If we put in stitches and close the wound, then all that stuff just gets trapped again in the skin. So we'll bandage a patient up really well, and they'll go home and then continue, when they take a shower and they need to change their bandage, they'll just put on change the bandage and put a new one, but we don't put any stitches. So, yeah, so I think he's gonna go in and open up the skin a little bit. Also, sometimes we'll inject Kenalog, which is that steroid, after draining to bring down inflammation. All right, so yeah, we make a pretty good incision into the skin. And right away, you see pus and blood coming out. If anyone watched Dr. Pimple Popper, you've seen
what comments were about. That's what.
Yeah, I mean, there's much worse on there. I feel like I could have found a much more gross video, but I was like, let me be nice.
I've been prepared. I watch them too. It's like literally so much comes out. This isn't even bad compared to what I watched on Dr. Pimple. Not bad.
Yeah, so we'll just keep, putting pressure and squeezing until basically there's no more pus coming out. But I wear a mask with like a little face shield and everything, because sometimes the pus comes flying out and can hit you in the face. So you have to be prepared for that. So yeah, so like I said, you're just going to keep draining. Sometimes you have to kind of open up the skin or make another incision, but you're just going to keep putting pressure, squeezing till all of it's out, and then you'll bandage up the patient. So, all right, everyone who turned away, if you weren't watching it, you can come back now. We're done. I promise. So, okay. All right, now we're gonna watch a few videos on biopsies, because this is honestly one of the most important things in dermatology is biopsies. I remember when I first started in dermatology, I could not do a biopsy to save my life because it just takes practice. But I do biopsies, all day long, and I do them in every single place you can imagine. So you have to be really good at doing biopsies. So this is a punch biopsy. So this is a biopsy that goes a little bit deeper into the skin, and then you have to put in stitches. So I have 2 videos on punch biopsies. This one's a little bit better because it's a little more slow and you kind of see more, but also it's a little bit blurry for some reason. So the next video is a little bit more clear, and we'll kind of just like watch that one as a review. But again, you're gonna inject numbing. So you're gonna numb the area pretty well, because like I said, you're gonna go a little bit deeper, and you take this tool and basically you're going to put it into the skin, and you'll see in the video, but you'll turn it as if you're taking like a little pizza slice out of the skin, and then put in some stitches to stitch it up. So he's cleaning the area right now with some alcohol, and then he's going to go in and inject with numbing. So we can kind of fast forward that a little bit. Okay. So he's injecting with a numbing. Again, it does hurt a little bit, but if we didn't inject numbing, it would hurt a lot more. So he's injecting numbing to make sure the area, it's going to be not painful for the patient. And then he's going to go in with our punch biopsy tool, and you'll go into the skin and then turn the tool around. So this is the tool. So he's going in, and then see how he's turning it back and forth. And then this allows it to go into the skin. And then once it's flush with the skin, you pull it out. And then there's the piece of skin right there. He's going to pull that out of this guy's face and then send it to the lab for testing. Or I'm assuming he's sending it to the lab for testing, but we don't always send it to the lab. If it's a cosmetic thing, then we're not sending it to the lab. And then he's going to go in and put in stitches, because now there's this hole in the guy's face. So you can't just leave that there. So he's going in and putting in stitches. This was a rather small punch biopsy, so he's probably only going to put in like 1 or 2 stitches, but sometimes we'll do some bigger ones where we have to put in, a few stitches. And then usually a patient comes back in around like 2 weeks, and then we'll take the stitches out. So also, I suture, which suturing means putting in stitches. I do that quite a bit as well. So I think that's something that people don't think that we do in dermatology, but yeah, we do quite a bit of stitches. So that's his stitches, but I'm going to show you guys the next video, which is a little bit more quick, but it's a little more clear. So she's doing the exact same process. This punch biopsy is a little bit bigger. So like I said, there are some bigger ones.
Punch biopsy.
Oh, shoot, hang on. There we go. All right, so she's injecting the area with the numbing medicine. And then there's the punch biopsy tool. Again, it's a little bit bigger. See how she's turning it? And then as she's turning it, that's how it's going into the skin. Then that's a piece of skin. She's cutting it out. Yep.
Right out.
Yep. And then that'll probably go to the lab for testing. And then she's going to put in some sutures or stitches. So this is exactly how we do our sutures or stitches.
How long does it take, for the skin to just heal? And
so they're going to come back in 2 weeks, and we'll take the stitches out. And by then, pretty much it's closed. And then it's going to take a little bit longer for any, redness or anything to go away. But the best care for it is, again, putting on Aquaphor or Vaseline and a bandage. That's how you care for it. So now that you saw some medical patients, so now we're going to go into some cosmetics, because I do cosmetic procedures. And about 2/3 of what I do is medical, but then like 1/3 is going to be cosmetic. So I do Botox, I do fillers, fillers in the lips, cheeks, chin, chemical peels, microneedling. So microneedling is this device that goes over the skin, and it causes trauma to the skin to stimulate collagen growth. It's really good for acne scarring. Laser hair removal. Other laser surgeries, there's other lasers that I use for like rosacea, angiomas, which are these red spots people get on the skin. PRP, which is platelet-rich plasma, that's becoming a more popular procedure. I do it for hair loss, but you also can do it for rejuvenation of the skin as well. So I'm not going to go into detail about all these cosmetic procedures, because that's kind of a lot, but I will show you just one quick, okay, never mind. There was a cosmetic video in here, but I guess it's not here anymore. Okay, never mind. There was a video of someone doing lip filler, and I was just going to show you guys that quickly, but I don't know what happened to it, but that's okay. So now we're going to do the questions. So hopefully you guys paid attention, and you can just answer these questions right away. I'm gonna read it out loud, but you can answer it right away if you know the answer. So on average, how many years is PA school? We're not including undergrad. A, 5 years, B, 2 to 3 years, C, 10 years, D, 1 year. So I'll give you guys a second. And remember, someone's going to win a prize. So this just shows how much you guys are paying attention.
A lot of these. I mean,
you guys better get these all right. Yeah, so B, 2 to 3 years. Question 2, what is the certifying exam that one will take after PA school to become certified? Is it A, B, C, D? This one could be a little bit tricky because I kind of made them all similar, so that maybe it would throw you guys off. But if you guys were paying attention, then you'll know.
Yeah, it's going to take a second. We're still on the B's, the last one.
Oh, okay. All right. I'll give you guys a couple more seconds.
There we go. Pants.
Yes. So C, the PANS exam. Yeah. So I made this one a little bit tricky. All right. C, what is a common modality, meaning what is a common treatment we're going to do for warts? So A, ILK, which is the Kenalog injections. B, benzoyl peroxide, like a topical benzoyl peroxide wash or gel. C, cryotherapy, liquid nitrogen, which is that freeze spray. D, punch biopsy. I'll give you guys a couple seconds.
Oh, it's just blowing up. There we go.
It's C, yeah, cryotherapy, liquid nitrogen. It's that freeze spray. If anyone's ever gone it before, it's so cold it stings. So it's not super fun. But
okay, let me see here. Before I do pick a winner, I just want to say that I'm not picking. I have to pick one. I mean, all of y'all have been really great. I really liked how everybody was here today, was answering questions and kind of like giving information about like type of things to do. I thought that was really nice of everybody. I'm just gonna pick one. What you got to do is just DM us on Official Club Med, and we will put you in touch with Nicole, and she can give you details about the gift part. And the winner is going to be Alicia Lee. So if you're Alicia Lee, please DM us on Official Club Med, and I will get in touch with Nick. I'll get in touch with you, Nicole, and we can go from there. Alicia Lee. But other than that, I know we're out of time. Before we get out, do you have any last piece of advice for high school students or college students just before we go?
Yeah. I mean, I have a lot of advice, but I think right now, just the most important thing, because I just went over a lot of information and I feel like it's overwhelming. So I feel like just really try to simplify it and, just keep track of everything, make a chart, write everything down of everything you need for PA school and a plan of how you're going to get everything for PA school. I just think that keeping everything organized is really going to help you. Like I said, you can follow me on my social medias because I do try to do a lot on there. I try to answer because I get, quite a bit of DMs. I obviously can't answer all of them, but I do look at my DMs. Like I actually see every single DM and I try to pick out the ones that I see the most and then I'll answer them, as videos and stuff. If you guys like me, so AAPA, which is an organization for PAs, does the PA of the year. And so if you guys like me, you should nominate me. So the link will be in my bio. It will go towards, I think it ends February 19th, but the link will be in my bio. If you want to nominate me, you just need to put, you need to know a little info about me. You just need to know my first name, last name. So Nicole Finn, and then my email, which is NicoleFinn@kings.eu. And I'll have my email. Well, my email's already in my bio, so that will be in there too if you forget it. But if you don't like me, obviously don't nominate me. But yeah, only if you like me, nominate me. So
I'm loving it. Like there's so many people who are grateful for what happened today. I mean, that's been a really good call. But that's cool. So be sure to go into the bio of Nicole, make her the PA of the year, go into her link, put her name down, put her email down. Let's make her the PA of the year. But other than that, it's been great, guys. We will post more information about next week's call. Again, just hit subscribe and that just notifies you right when we go live. Other than that, you can also sign up for email reminders. If this was a call for you, we also had a PA call last week. That was very interesting and was really cool too. So be sure to check that out. But we're going to have more calls from MDs, DOs, nursing, all that we're going to have. So be sure to check that out. And I will see you guys next week. Thank you so much, Nicole, for your time and everything. It's been a great call with you.
everyone.